Thank you very much for this kind invitation. I'm Dr. Carlo Bellieni, a neonatologist based in Siena, Italy. I work in the intensive care unit. I've been doing research for 20 years in the field of pain treatment of term and preterm babies. These babies are often born very prematurely, just in the middle of the normal gestation, and this is a great concern for them, for their parents, and for us. Other times they are delivered term, but some problems such as infections can provoke birth asphyxia, and we should sadly help them breathe. This provokes stress to the parents, stress to the nurses and doctors, and stress to the babies. It is hard to believe that a fetus, and these patients are really fetuses, that a fetus can go through stress, but they can, and we should avoid it and prevent it. In order to do this, we should first know what stress is, then what are the causes of stress and its consequences, and last, how to overcome it. Stress is a daily event in the life of any hospitalized subject. The separation from parents and relatives, the relegation in bed, procedures, lights, noises, are stressful for every hospitalized patient. Are newborns different? Do they undergo and feel less stress when in hospital? Absolutely no. Newborns have a well-developed stress detecting system formed by their amygdala, the hippocampus, and their connection with the hypothalamus, hypophysis, corticocerebral axis. And this system responds very well to stress. It is a defense, but it is also the detector of stress, with consequent unpleasant sensations and long-term risks. The next slide will show where amygdala is in the brain. The headquarters of the anti-stress system in our brain is the limbic system, where the amygdala and the hippocampus have several important functions: responding to stress, managing fear, storing memories. Stress activates the amygdala, and when stress is too much, this alters these three mechanisms. Prolonged stress alters the response to stress itself, the response to fear, and the acquisition of memories. Stress also increases blood pressure, provokes tachycardia, and increases the level of excitatory amino acids. In a recent study, stress was applied to rats. How do we induce stress in rats? Introducing a new male rat in well-established colonies. This provoked aggressive behaviors among them and an increase in cortisol blood level. Researchers saw that this stress produced long-lasting effects on the incorporation of new hippocampal neurons and in reducing their survival. Thus, stress alters physically the stress-preventing system, with long-term decrease of the ability of responding to stress. The slide shows the results of this study. This is not only an experiment, it also happens in babies. Mothers that have maternal negative affect during infancy will have children that with disrupted patterns of diurnal cortisol and EEG alpha asymmetry during childhood. Two markers that show the decrease of active stress coping when children. Studies show that children suffer the consequences of if they were exposed to stress when babies. Altered response to fear, negative behaviors, lack of attention, and alteration in EEG symmetry when grown up. Here I show the results of one of these studies. Early stress also provokes a higher possibility of alcohol addiction, of morphine dependency when adults. But it also increases levels of novelty-induced anxiety, impairment in learning and memory, anxiety, depression, hypertension. A common source of stress is repeated pain. Pain can be extreme, like in non-anesthetized patients, and it was not uncommon until the end of the 80s of the last century. This can lead to brain damage for the sudden dramatic increase of blood pressure in brain vessels. Or pain can be lower but repeated, leading to severe stress, and it is not uncommon now. Babies in neonatal intensive care units undergo a mean number of 10 to 14 painful procedures per day. The first consequence is that these babies will have long-term changes in pain sensibility. First, they will provoke a reduction of glycine receptors for pain in the brain that will produce a systemic increase of pain threshold. Babies who received many painful procedures when newborn cry less than the others during immunization punctures several months later. The second consequence is an increase in nociceptors in the area where repeated pain is provoked, such as the heel in the newborn, with a decrease of the pain threshold for stimuli that will be applied there. So babies who receive many painful treatments will have a general hypersensitivity to pain when adults, and a local hypersensitivity in the excessively stimulated area. An interesting study performed with the help of MRI showed that the thickness of the grey matter at the age of 7 years correlates with the amount of painful procedures the baby received at birth. The more numerous are the painful procedures, the thinner is the gray matter when child. I've just described some stress-related mechanisms that can lead to brain damage, blood pressure increase, and activation of the